Dr. John, that was such a great video on acupuncture, but I loved how you showed different modalities, because the difference between, of course, you know, Oriental Chinese medicine, right. When you think of acupuncture, you just think of the needles.
Correct.
So would you go ahead and go into detail a little bit more about other modalities?
Some of the other modalities, sure.
Yes.
Well, people commonly think of needles because that's kind of the most common thing that they see on television. It has a certain appeal to it and mystery about it. But some of the other modalities are similarly important. So cupping is one of the things we showed there, and we can use that as stationary cupping, which is the first technique we did with Shannon. We call that fire cupping. And that's to draw out stasis in the tissue, where things have stopped moving. We might use that typically if somebody has a common cold or a very localized area of pain in their back. The second procedure we used, where we added the oil, also grabs the tissue, but now we have a medium, that oil, on which to move the cup, so it's quite comfortable for people. And again, what we're trying to do there is move qi and blood to create movement in the tissue. We could see a little bit there on the video that the tissue, Shannon's skin that is, was getting red because the evidence of the blood moving in the tissue.
Right.
Other things we'll use will be Tui Na, which translates as push grab, and that's the manual manipulation of soft tissue, ligaments, tendon, muscle, where we use our hands. Very good for pain kinds of things, musculoskeletal pain things. And moxibustion, where we burn an herb around the tissue, not on it, but around the tissue, to warm the channels. And again, this creates movement of energy in the acupuncture meridians.
Right. And it's so important to get the blood flow.
Oh, absolutely. It's key. It's the blood that nourishes the tissue in our entire body, but the Chinese would say it's qi that moves the blood. So we have to unblock and move that energy in order for the blood to properly flow to the damaged tissue.
Well, also in that video, when you were inserting the needles, and I loved how sterile that was as well, and that scares a lot of people.
Sure.
But I didn't see her flinch at all when you were inserting the needles.
Right. It's a relatively painless procedure for most people. It kind of depends on what part of the body we're needling sometimes. If we're needling on the tip of the fingers, for example, where the tissue is pretty shallow, we have to be more careful. We use a very fine, thin needle there. On most people's back, where there's sufficient amount of tissue, they very seldom feel anything. Most people feel very little when they're needled during an acupuncture procedure. They might feel a little warmth or tingling or kind of a dull heaviness. It's really described by most people as a fairly pleasant sensation.
Okay. And along with that, you know, not only with the other modalities that you have, you also use therapeutic type of herbs?
Oh, absolutely.
Yes.
Matter of fact, when Shannon was departing the clinic there, you could see off to her left a little bit, part of our pharmacy. We have probably one of the most diverse herbal medicinal pharmacies in the Twin Cities. We use bulk dispensed herbs, which is the standard of care, the standard of practice in China today. And we have pills and tinctures and powders, but these are always combined into what we call formulas, which will have anywhere from half a dozen to 15 herbs in them. And some of these are classical formulas. They've been around for thousands of years and therefore have obviously been used on a great many people with consistently good results.
Sure. So each person that comes in, you assess them and you look at them, of course, holistically, and you take the stress of their lives.
Right.
And maybe even, for instance, what they do professionally, and look at that, and then you can also assist them with that as well.
Yeah, I would say really any kind of good medicine, and I'm giving you my opinion here now, but really takes a fair amount of work. It's really sitting down with a patient, understanding what's occurred in their life, what's going on in their life, what are their choices in life, their lifestyle choices.
Sure.
It's those kinds of things that over time lead to either optimal health or some kind of malady or illness, disease, or pain. And so you really have to kind of get underneath that and work with that in some detail. That takes some continual conversation with the patient. It takes them being a partner in their care, because now we're going to potentially change behavior. So as well as those symptomatic treatments we use in clinic, acupuncture, moxa, cupping, and so forth, we also educate them a little bit about maybe making some different lifestyle choices, modifying their diet, getting moderate, regular exercise, managing their stress. These are the things that will help them avoid illness or recurrence of illness and help them have a happier, healthier, longer life.
Yes. So you actually spend a little bit more time with them. Let's say the first visit, about an hour or so?
At least an hour.
At least an hour,
When
okay.
we're gathering information, basically we're creating our database.
Sure.
And so we want to make sure we're getting as much information we can, and that information is accurate as can be. And we'll oftentimes go back over the second or third visit, subsequent visit, saying, now, is this accurate? Did I get this correctly? Is there any new information you want to share with me?
Sure.
If they've been getting other medical procedures along the way, what are those?
Sure.
How are they responding to those? That kind of thing.
Yeah, because the ultimate is, of course, getting that patient well.
Absolutely. Getting them well as fast as we can for as inexpensively as we can.
Yes. So that brings up my next question, of course, is this covered by insurance?
Oh, great question. Yeah, we are a participating provider for 3 major carriers here in the Twin Cities. Health Partners, Medica, Preferred One.
Okay.
We also are a carrier for many other insurance companies, really nationwide, but where we might be what's called an out-of-network provider. And so I have personally a long experience in insurance industry since I worked in that industry previously. So we can provide a lot of help in answering questions about whether or not somebody has coverage and what those benefits would be and so on and so forth.
Yes. Well, now I'm thinking, what if another person didn't have the same symptoms as Shannon, of course? So what other techniques do you actually help or relieve, general aches and pains, or is there anything specific, or are you pretty broad?
People do tend to think of acupuncture as a pain relief kind of treatment. In fact, when you go back and look at Chinese medicine professionally, it covers a wide array of conditions. Asthma, hypertension. I'm treating people, as you know, we've talked about this, for what we call post-stroke sequelae, somebody who's had a stroke and they have symptoms of paralysis, numbness, tingling, loss of function. I've treated people for that. I'm currently treating people for that. Infertility issues.
Oh, okay.
Stress. It's a very, very long list.
And in regards to that, I guess you have a testimony from someone that you really helped, and she was so gracious of what you had done from all the other people that she had seen, that she actually wrote you a testimony.
Yes, I brought one of them.
Yes.
We have patients that have listed testimonies on our website.
Okay.
But this is a woman, middle-aged woman with 2 young children, who presented at our clinic complaining of severe pain. She was in such pain that she couldn't play with her children because if they bumped into her or sat on her lap, it would cause her excruciating pain. She also had severe vertigo, which is a sensation of the room spinning. And we worked with her for a time, and I had her on 2 herbal formulas and acupuncture, and really she feels kind of like a new woman. I'll read what she wrote to us.
Yes.
She said, "I feel better than I have in many years. I went to John Walters at HealthPoint Oriental Medicine for fibromyalgia and chronic pain. I've been having so much pain that it was difficult for me to play with my small children. He was very earnest at helping me find solutions for my condition, including using acupuncture, Chinese herbs, and Tui Na. After only 2 months, my pain level has greatly reduced, my sleep is more sound, my mind is more alert. He has really helped me get the quality of my life back." So she's obviously a satisfied customer. And we have a number of them like that, but it's nice to bring along something so people can understand how we help others.
Exactly, and that's kind of what Knowledge for Wellness is all about, to educate and to expose, and you're giving her back her quality of life.
Exactly.
Yeah, that's fantastic. It just warms my heart to know that, so yes.
Thank you.
So any final points, no pun intended, in regards to that you want to throw out to my viewers?
Yeah, well, I would emphasize the education, as we've touched upon a time or two. Seek out a licensed acupuncturist. You can find that by seeing the initials capital A period, capital AC period after the name, licensed acupuncturist. And get somebody who does this full-time if you possibly can. Somebody that's got experience treating a wide number of patients in a wide variety of conditions.
Wow. Well, I want to thank you, and we've run out of time, so
thank you,
of
Tina.
course, it's been great.
My pleasure to be here.
All righty. Thanks so much for
Thank
all
you
your
so
insight
much.
on this information.
Thank you for having me.
Yes. For more information about HealthPoint Oriental Medicine, please visit their website at www.healthpointclinic.org. And please tune in to my other shows of Knowledge for Wellness being televised throughout the Twin City area, or view my website at www.knowledgeforwellness.com for more detailed information. You can also connect with me on YouTube, LinkedIn, Twitter, or Facebook. And I sure hope we have provided you with more knowledge to benefit you and your loved ones. So until next time, be well and goodbye. Thank you.
Over time you've healed so much in me, and I am living proof that although my darkest hour had come, your light could still shine through. And at times it's just enough to cast the shadow on the wall. Though I am grateful that you shine your light on me at all. Who am I that you would love me so gently? Who am I that you would recognize my name? Lord, who am I that you would speak to me so softly? Conversation with a love most high. Who am I? Well, amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found, was blind, but now I see. And the more I sing that sweet old song, the more I understand that I do not comprehend this love that's coming from your hand. Who am I that you would love me so gently? Who am I that you would recognize my name? Lord, who am I that you would speak to me so softly? Conversation with a love most high. Who am I? Grace, grace, God's grace, grace that will pardon and cleanse within. Grace, grace, God's grace, grace that is greater than all our sins. Yeah, who am I that you would love me so gently? Who am I that you would recognize my name? Lord, who am I that you would speak to me so softly? Conversation with a love most